Hello, everyone. Welcome to our lecture on motivation and motivational interviewing. This will be a tool that will kind of go hand in hand with all that you've been learning about behavior change theory as we apply this knowledge to patients. As physical therapists, we are very often focused on one simple aspect of physical therapy care, and that's a home exercise program or instructions that we're giving the patient. And very often, the patient's long-term success hinges directly on their compliance with these instructions and these exercises. All the great manual techniques in the world and all the magic that happens in the clinic often is not sustained if we don't allow the patient to experience that over time as far as repeating those valuable exercises and movements. So we think about motivation. This slide here says it's not that I'm lazy, it's just that I don't care. So trying to find, if you remember back from Foundations when we had Dr. Michelle Moore helping us with anatomy and foundations, I remember her talking to us about finding our own why as physical therapy students and as physical therapists. What is it that motivates us? Why are we doing what we're doing? And when we see the long-term goal, then we have renewed motivation to survive PT school, maintain our energy levels, treating patients, whatever it might be. And the same is true for our patients. If we can help our patients to understand why, for them personally, physical therapy can be beneficial, now the motivation is coming not from us being a cheerleader, but instead coming from within the patient, and the compliance with home exercise programs increases exponentially. There have also been research studies done talking about memory and motivation, and not surprisingly, when an individual is motivated and cares about a certain topic area, their memory of that area and their retention improves. Makes sense. So if we can help motivate our patients to find their why, then they will very likely be more compliant. So this often presents a challenge for us as clinicians because we do have so much knowledge that we know the patient needs. And so this motivational interviewing discussion will talk about how we can do both. We can educate our patients, give them the knowledge that we have, but at the same time, extract from the patients their intrinsic motivators and help them to be motivated from them within themselves. So everyone's different. Some people are more motivated by extrinsic factors, material rewards, pay for a job, a cash prize, words of affirmation, grades, competition. However, the longer lasting and more meaningful types of motivation are intrinsic. And so we as individuals and as therapists should be trying to develop the right side of this chart and find ways that being a physical therapy student and eventually being a physical therapist satisfies us personally. That will increase our longevity. We talked about in the resilience lectures about burnout in physical therapists, and finding intrinsic motivation will help prevent that. Also with our patients, when we can direct them this way, or really help kind of lead them so they can discover this themselves, they will then be much more likely to maintain those actions, such as compliance with their home exercise program. So motivational interviewing is a client, or we can say patient-centered style, where we're trying to help the patients to change behaviors, such as do their home exercises, by exploring and resolving ambivalence. So when we talked about behavior change, we talked quite a bit about the pros and cons of decisional balance, if you remember from some of those theories, why a patient would not want to change their behavior and start doing their home exercises, and why they would be willing to do that. And so we are not trying to convince the patient of our knowledge necessarily. We're trying to help them discuss and feel that ambivalence and explore that for themselves. And this can be done many ways. It can be done using humor, using personal experiences. Really throughout the history of mankind, I think exercise and movement is always beneficial. Some people do it readily and others struggle with that, but it's always there. And so we're not reinventing the wheel as PTs. We're really just trying to help patients to kind of discover, maybe rediscover, maybe they used to be an athlete and now they're not as active as they used to be, or maybe they've never been active and we're getting them to discover the benefits of movement and how much better their body feels, how much improved their sleep is, and so forth. So the history of this approach, which probably doesn't matter a huge amount to you, and that's okay, but first came out in the literature in '83. This counselor named Carl Rogers used a client-centered, or we would say a patient-centered approach, where his approach would say the patient is the expert. They know themselves and their body better than anyone does. And I love this approach as being a PT. I've said these words to my patients. You know your body better than anybody, and so you are the one who really knows how you feel and why you feel the way you feel. And so this gives validation to the patient when they're describing their pain or their frustration and so forth. And it also kind of inadvertently puts the responsibility on their shoulders that, at the end of the day, it's your body. And I'm trying to help you as a therapist to improve your body's function, decrease the pain and so forth. But as we are able to kind of shift that responsibility to the patient, two things happen. One, we as clinicians, we don't need to take all of our several patients on our caseload for a given day. We don't need to take their problems and issues home with us to our spouse or to our family life, whatever it may be, or just to our own personal well-being. We need to, or we can, in this regard, let the patients own that and help them to discover kind of that responsibility, really that opportunity that they are the only ones who can take charge of their situation. And by doing so, they're going to feel better and we will have been successful. So some of the basic principles of motivational interviewing, as we said, we are trying to roll with the patient, solicit from them their feelings, their thoughts. We want to empathize with them and say, I understand how frustrating it can be to have pain and pain over a period of time and pain that affects different parts of your life. And so talk to me about how that's affecting you. And as we get them to talk, we will be able to help them discover why they really want to do the exercises we're asking them to do. You've learned about self-efficacy. We're trying to help our patients to have the confidence that they can overcome whatever their perceived obstacles are. So obviously, we need to get them to talk about that. Tell me a little bit about why why you have difficulty exercising. It's a universal challenge. I'm a PT myself. I understand all these things, and I struggle trying to exercise. So I'm right there with you, patient. So talk to me about some of your feelings about struggling to exercise. And so then you get them to start talking about it. We should be in the top left dancing with our patient. I don't know who the saxophone player is here, but that's kind of irrelevant. But we want to dance with our patients, help them explore what barriers they perceive, what challenges they're feeling. We don't want to, on the bottom right, argue with our patients or be in a competition to show them how much we know. They've already come to us, so on some level they already recognize that we have something to offer them. So now let's let the focus be on the patient and have them talk to us about their feelings, and that will take us much further. One of the documents you have in Canvas under this module, this information comes from that, a study talking about motivational interviewing and patient education. And as we've said many times, we as PTs enjoy a very unique situation where we have a lot of time with our patients compared to almost any other discipline. So that allows us to develop rapport and trust and understand much more about who they are in the world. And so that helps us to know patients on a much deeper level and help them to recognize these discrepancies. Maybe they really value their body and their health and their family, and they want to live longer and they want to live with less pain. And so the time that we have with them allows us to understand that. This slide shows us a little bit about the delay. The dogs were barking. This slide shows us perhaps some of our tendencies as a human and as a therapist to respond in a conversation with a patient. The boxes that are outlined here really demonstrate how we might use motivational interviewing techniques to interact with a patient. So instead of focusing on our own point of view and how much we know, the motivational interviewing approach would listen to the patient's point of view and then hear what they say about themselves and accept and clarify what has been said. What we're trying to do is elicit from the patient their feelings, their conversations about their body, their activity level, and so forth. So we may sense feelings that are not being expressed. We may sense that they feel stressed and they feel that their schedule doesn't really allow them to exercise. They may feel discouraged, and they may say some of those things. But we're trying to get them to focus on this discrepancy, this ambivalence. Why are they, how, and not why, but also how they are struggling with the desire or the perceived need to exercise, but the perceived obstacles that are getting in the way of that. As we said, we're trying to collaborate or cooperate with the patient. We're trying to look at the situation through the patient's eyes. Again, respecting their autonomy. It's their body. No one knows it better than they do. And that curiosity about, tell me how you feel. It matters to us as PTs. We want to know. We need to know what's going on inside their brain and their heart and their body. What's happening with them. In that way, we truly partner with the patient. We truly are collaborating with them and helping them. We've already learned many of these objects on this list here: decisional balance, pros and cons, stages of change. Are they contemplation, pre-contemplation, action? We know what self-efficacy is, so we're trying to take all of these things into account. This values clarification is really just a way that we get to know the patient a little bit, what's important to that patient. And this will be a great resource when we start trying to talk to them about, therefore, because God is important to them, family is important to them, their health, being disciplined, whatever it may be, that will help us to kind of reflect back to them so we understand who they are, what motivates them. Now let's have you apply that to your exercises. We've talked about this as well, also with behavioral change, just trying to get a sense of how urgent the need for a change may be, why it may be important for them to change or not. So also, these methods are important to, we're using the example in this discussion about home exercise program. So that's the target behavior, trying to get them to talk about why the healthy behavior may be valuable to them, why they don't think they can do it, whatever their thoughts are, and trying to just have the patient explore that ambivalence, that challenge, because with that exploration, the patient will discover their why. They'll discover why they want to and need to change. And now our job is really done. Now we can teach them what we know will benefit them, and they're intrinsically motivated to do it. So we talked about decisional balance, basically pros and cons. Why is exercise important? Why is it a challenge to do? And so forth. And so reflective listening, there's a document also in Canvas that talks about ways that we can reflect back to the patient, how we can basically get at what they're thinking and feeling. And so ultimately with motivational interviewing, it's all about the patient, right? It's client or patient centered. We're trying to extract from the patient their thoughts, feelings, and ultimately their motivation to get better, to feel better, to be more active, whatever the discussion item may be. And that is the magic of motivational interviewing, because that is where the true power lies. We now have this individual saying, you know what, I want to finally fix this back pain, or I want to take the steps needed to begin the journey to get my shoulder pain to go away, whatever it may be. And so this is a lot of what you've heard Dr. Richardson say to you many, many times, seeing your patient as an individual, reading your patient. Are they stressed? Are they discouraged? Are they in pain? Are they happy? What it might be. And just that curiosity and that interest in them and the value that we provide to them goes so far in establishing that connection, that therapeutic alliance with patients, so that we are working together with them to help them accomplish their goals. So that's motivational interviewing in a nutshell.